This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, the Long Island Gynecomastia Center, and today I'm adding to my YouTube video channel a gynecomastia on this young man. He is 20 years old. He actually flew in from London, United Kingdom, because I'm the best at gynecomastia. He saw some people in London, and they only wanted to do liposuction on him and not the gland. But he's 20, he's fit, he's tall, good-looking young man, and he does not need liposuction. All he has is gland of gynecomastia, what we call puffy nipples. I've already numbed him up, so he looks more swollen than he usually is on both sides. I've already numbed, and if you can appreciate the whiteness, that's the epinephrine I use because there's absolutely no bleeding during this operation. So anyway, the guys in London wanted to do liposuction, and they were smart enough to say, no, I don't need that. It's really just the gland that I need to be removed. And all males have gland, and no matter what type of operation you do, all males need the gland removed. Liposuction actually is just an adjunct, just an added thing to sculpt and contour the chest, only if they have extra fat, in the chest area. He doesn't. He's 20, he's fit, he works out, eats well, and all he needs is the gland removed. So I've already numbed him up, and I'm going to make a little incision. I use my incision a little bit more laterally now because the gland is kind of in the center, that ground zero, but it goes more into the tail of it, which obscures that nice hockey stick boomerang shape of the pectoralis major muscle itself. So here we go. He's already numb. He will not feel anything, and he's awake. So we make about an inch incision, right lateral, more lateral than on the bottom. And as you're going to see, this is going to be a phenomenal thing. You're going to see this gland, which has been what I call hydro-dissected already, kind of pop out of here beautifully. I gave my local through here. And this is, you can see that. The yellow is fat, and the white is gland. So, and you're going to feel pressure, but not much at all. Cookie is my nurse. Joe's the patient. And you see that? That is. So the yellow we're going to leave in there. I'm going to piecemeal it out in a few minutes. And I do more of this basically in one day or 1 week that other plastic surgeons see in their whole career. So I bluntly get in there. I want to get down to under the gynecomastia, to really the surface of the pectoralis major muscle. And there's where I am. The tumescent, the fluid that I use, kind of helps dissect that out beautifully. And the fluid that you see coming out, that's just the fluid that I use to dissect. So here I am, and that is the edge of the pec muscle. Get right on under. So I find it easier to peel it off from medial to lateral. So I'm all on the surface of the muscle. And I'll show you the muscle, guys, in a few minutes. And you can kind of see the muscle right there. That's the muscle. And as I do it, I kind of... So this is the gland. Little fat attached to it, but mainly the gland. And when I'm in there, once this is out, then I'll look at the fat there and kind of sculpt it from the inside nicely. You get into that beautiful plane underneath the gynecomastia on top of the muscle. You can really just kind of scoop that out beautifully. That's good. So I can get right underneath there. Got to leave some gynecomastia on the undersurface of the nipple because you don't want any retraction of that nipple.
Okay.
So now I've dissected this all about, and this is the gynecomastia. So right now it's stuck underneath the nipple, as you can see. See that, Joe?
Yeah.
So what we do now, grab it with a little towel clip. I always leave a little gynecomastia still on the nipple, under the nipple, and because at first I want to leave a little bit there because I don't want to take too much off. And then I'll fine tune it before I close. Great. And that is the initial gynecomastia. And that's, I'll let you feel it. That's the smooth where the muscle was, and that's where it was underneath the nipple. We'll have you put on gloves, Joe, when we're done. And that's beautiful. Still need to debulk it a little bit, but I'd rather leave stuff in there rather than take too much out.
Okay.
So now this is a little too thick. So this is the artistry of it now. Still a little bit right here. I know what to do. That's perfect. That's, I can contour that a little bit. Good. What's great about doing it on the local, besides many things, is I'm not running by the clock. Oh, that is magnificent. So I can feel the thickness all the way around. Coming out here, a bit more lateral. And I can see this glob. See this glob of fat there, guys? Right there? This glob, we don't like. And I think people should be beautiful inside and out. Joe's beautiful outside. Inside here, we're going to make him beautiful. Beautiful. And I'm going to waffle weave this a little bit. Flatten it out. Just got to leave a little bit there. Beautiful, beautiful. If I can show everybody the anatomy, this is the surface of the pectoralis muscle right here. And notice I did not get into it. You don't want to get into the surface of that because it could cause scarring. So I'm stopping little blood vessels and also contouring a little bit of the fat. Now I got to be very OCD about this because he's going back to London. When are you going back? Over the weekend? Friday. So today is Tuesday. So I can't have him have any problem. So I'm taking every single effort to make sure that there's no bleeding. That's very important. Otherwise, it would delay his going home. And I get a good 50% of my patients from out of town. Not only in the New York, New Jersey, Connecticut area. So as you can see, there's no bleeding. It's contoured beautifully. He did not need lipo. That would be the absolute wrong operation for him. And next, we're going to do what I call my quilting stitches. And that removes the space from where the gland was removed. So fluid will not collect. What happens is that fluid, when it collects, it'll cause extra scarring. So I grab a little bit of the undersurface and just the surface of the pec fascia, just the not the muscle itself, just the fascia that covers it. And that brings everything, it quilts it down almost like baffling of a down comforter, so the down doesn't shift. You follow me?
Yeah.
So here's where I can't see. I can't get up there, can't get lateral, can't get down here, can't get medial. So what I do now is I don't, and I put in a little rubber band drain underneath so fluid will not collect exactly underneath here. Okay, so these are, all my stitches are all self-absorbing. So side one is pretty much done. How was that?
That's good.
Good. So that is amazing. So let's flip on over to the other side. Okay, so we finished side one. Went fantastic. Now we're going to side two. Important to have passion in what you do.
Yeah.
It's important.
I bet it's a satisfying job, isn't it?
It is. I get people from all over. And guys are so appreciative. All right, so that is absolutely perfect.
What is it attached to?
Undersurface of the nipple.
Oh, right.
Right there. That's ground zero.
So it doesn't really attach to the pec muscle?
It's, I'll show you in a second. That's a good question. It's very, I get into this plane where you can, like, you know, finger fracture it, I call it.
Yeah.
I'll show you how smooth it is. The plane where you... There you go. So you'll see, that's it attached to the nipple there. But look at this smooth side where it goes. See, I got into the perfect plane. Same thing on the other one. So this is the undersurface. This is not as bloody because this has been dried for, you know, for an hour or so. And then ground zero, you know, underneath the nipple.
Underneath the nipple. Wow.
Right, that.
Yeah.
So now what I've done, and they're both about the same size.
Yeah.
You can kind of see. They're both pretty much identical. So now I got the majority out, and I can feel there's some stuff there, a little thickness there. I'm always a little cautious. You leave a little bit in there, because again, if you lose track and you take too much out, you can't. It's gone. You can't add it. So one of the things I do is I just kind of waffle weave. So now I'm quilting. That prevents fluid collection. This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, located in Huntington, Long Island, New York, the Long Island Gynecomastia Center. I get people from all over the world, Europe, all over the USA. They fly in for my expertise, my skills, and my extraordinary results. They stay for about 2 days and fly back home. Any questions about gynecomastia or any other plastic surgical procedure, please call myself, Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery. Phone number is 631-424-0101. That's 631-424-0101. Hope to see you soon. Thank you.